Meningitis symptoms: fever, neck pain, light sensitivity, vomiting, muscle or joint pain, headache, confusion, skin rash, seizures, and cold extremities. In children, high fever, irritability, constant crying, headache, drowsiness, and vomiting. Meningitis diagnosis involves a physical exam, blood tests, and spinal fluid collection through a lumbar puncture performed by a doctor. The doctor will prescribe appropriate treatment and outline preventive measures for those in contact with the patient. Cerebrospinal fluid is normally clear and distinct. In bacterial meningitis, the fluid becomes cloudy. As it spreads through respiratory routes, avoid closed and crowded spaces. The disease progresses rapidly, so don't delay seeking help. If meningitis is suspected, take the patient to a hospital. Vaccination is the most effective way to prevent severe forms of the disease, especially bacterial meningitis, which can lead to permanent damage or even death. Various vaccines are available in Brazil to protect against the main causes of meningitis. They are given at specific ages based on exposure risk and disease severity. In Brazil, free meningitis vaccines included in government campaigns are meningococcal C, given in 2 doses at 3 and 5 months of age, with a booster at 12 months. For unvaccinated teens aged 11-14, a booster or single dose is recommended. We also have pneumococcal X, given in 2 doses at 2 and 4 months, with a booster at 12 months. We need to be careful with treatment. Let's discuss the 2 most common types, viral and bacterial meningitis. For viral meningitis, which is usually milder and self-limiting, treatment is supportive, hydration, hospitalization is rarely needed except in severe cases. Bacterial meningitis is a medical emergency and requires immediate treatment. It involves antibiotics, corticosteroids, and hospital care, including oxygen, IV fluids, and managing complications like seizures. If symptoms are suspicious or worsen, see a doctor immediately for proper diagnosis and treatment. Avoid self-medicating. The most common complications of meningitis, especially bacterial, include partial or total hearing loss, epilepsy, memory issues, learning difficulties in both children and adults, partial or total vision loss, delayed motor development affecting walking and balance, paralysis on one or both sides of the body, limb amputation if necessary to prevent spread of the disease, kidney problems, sleep difficulties, and incontinence issues. We must be vigilant because meningitis is a silent but potentially fatal disease. Recognizing symptoms and seeking immediate care can save lives. Protect yourself and your family. Stay up to date with vaccinations and practice good hygiene habits.